It is Live Bold and Boss Up podcast time. Welcome back, guys. It's Steph Ash here, and we're bringing to you a Synapse Summit Series episode. We chat with Rachel Feinman. Get this, she's the VP of Innovation at Tampa General Hospital, which, if you don't know, is one of the largest hospitals. Very prestigious, I think, exciting role, right? And how do you get to be head of innovation at a hospital, which is really exciting?
Yeah. She tells her story because she wasn't always in technology and innovation. She was an attorney before and just that journey on how she got to where she is today. So that was interesting. But then also all the innovation that is going on in healthcare today is mind blowing. Like I was like, wow, this is so cool and it's amazing. And the patient experience, the doctor and nurse experience as well, just all the technology that goes into it and what she's doing is just awesome.
Hmm. And for all of you Gator fans, she did go to UF. Sorry, Steph. That was probably bad.
No comments,
Steph is
but
like, hmm.
great school.
Just really smart. I'm really excited for this one.
You don't want to miss it. All right. Well, Rachel, thank you so much for joining the Live Bold and Boss Up podcast today. We're here live at Synapse, and Rachel is the VP of Innovation at Tampa General Hospital. So thank you so much for joining me.
Thank you for having me. It's exciting to be here. I always love Synapse.
Me too. It's one of our favorite events of the year. I think this is like our fourth or fifth year doing it, so we're big supporters. So being the VP of Innovation at a major hospital, what does that entail?
Yeah, I have the privilege of being the first person at TGH to have innovation in their title. And when I first started just over 4 years ago, most people, you come to an orientation for a new organization, a new role you're joining up and you're presented with a lot of materials. And usually you've got the organization's vision statement, mission, and I'm reading through and I'm seeing innovation throughout. Our vision is to be the most innovative and safest academic health system in the country. It's in our mission. And I'm thinking, no pressure. I'm the first person to have innovation in my title at an organization that clearly supports and is focused on innovation. So after I got over that, I take the role really, really seriously, given the importance of it. I just dove in. I have a great team, and we focus on driving towards that every day in a lot of different ways, which I'm happy to talk about.
Mhm. Well, so tell the listeners your background because it wasn't your traditional, like you didn't start in tech or innovation per se. You have a totally different background that led you to where you are today.
Yeah, I think, I was always kind of a straight line person. Went to college, and after college was like, I need a career. And then I went to law school, and then I was a lawyer. And it was pretty safe and it made sense to me at the time. And I got a lot of out of ultimately practicing law for 15 years. And I will say, when people think about what I was doing as an attorney and what I'm doing now, sometimes it's hard to draw the line. But for me, it's pretty straightforward. I was a business attorney. I spent a lot of time on the phone doing deals, so mergers, acquisitions, licensing deals, all kinds of things that involve businesses doing really cool, exciting, fun stuff to grow. And as an attorney, I always felt like the stuff that happened when I wasn't in the meetings, and the work that I wasn't a part of was the more exciting, fun stuff. So, um, and and once I started learning a little bit more about that, I realized I really wanted to be on the business side of things, and it wasn't a straight shot to figure out what or how that would go or what that would look like. But, I worked as an attorney with a lot of different investors at different stages and the companies that they invested in. So I had built a sizable network of leaders of startups, investors in startups, and really got involved in that startup world. And so, one thing led to another, and I leveraged a lot of that work, got a little bit deeper into healthcare startups specifically, through the work that I was doing before joining TGH. And I think at my core, I'm kind of a builder. I like to build new things. And so our CEO, John Corris, at the time, had written a white paper about the importance of innovating and what that looks like at health systems. And I think I was in the right place at the right time and told him I could help you build an innovation arm for the health system. And the rest is history,
Wow.
basically.
So then that makes total sense, the way your journey progressed to where you are today. It was like kind of you were in that space, you love the innovation piece of what you did as a lawyer, and it just kind of evolved. So just like organically.
Yeah, I had a stop along the way and this is something that I give advice to a lot of people who feel kind of stuck career-wise, and they're not exactly sure how to make what feels like a really significant change. I kind of, as an attorney and someone who, you make partner at a law firm, you have the same title and almost effectively the same role as the person who's maybe down the hall and 20 years more progressed in their career. And, I was looking at that and saying, do I want to do this for 20 more years? I'm not so sure. I think there's a lot of other skills, talents, experiences, and that I want to leverage in what I do professionally. And so, breaking it down into those skills, I always think, like, what do you want your day to look like? What do you want to be doing? Who do you want to be doing it with? More so than what job do I want to have. So I did that kind of introspection, thought about it, then leveraged that network that I had built of people and started having those conversations to say, hey, I think I'm more of a strategy person. I think I'm more of a business person. And just kind of waited to see what opportunities would come to me to leverage the kind of skills that I wanted to leverage. And so I actually had the opportunity to found and build an accelerator program. So if you're here at Synapse, you probably know and see a lot about accelerators, incubators, that kind of ecosystem to support entrepreneurs and startup founders on their journey. I actually built one of those accelerator programs that worked with Israeli startups. And a lot of Israeli startups are in healthcare. So got to know healthcare, got to know the team at TGH, and that was kind of my intermediate step along the
Wow.
way, if
I
you
love
will.
that. What a great journey.
Yeah.
Tampa General has been a leader in healthcare innovation. What are some of the most exciting advancements happening right now?
So there is so much happening at such a rapid pace in not just healthcare, but I think in AI. And sometimes we have these fads or these technologies that you feel like, oh my God, here they go again, talking ad nauseum about what fill in the blank. I mean, maybe we'll say blockchain.
Mhm.
But AI is just, it's different, and generative AI in particular, and the pace at which it's going to transform not just the patient experience, but the provider experience is significant. So we're spending a lot of time in that space, toying with agents, agentic AI, and how it's going to help streamline our patient experience. We've brought in ambient listening into the doctor's office and the clinic, which basically means that your provider can get out from behind their laptop screen again, and stop furiously typing as you're talking, and they can bring their attention back to you as a patient. And not only does that help the patient experience, but I think people underestimate how challenging it's been for providers to have to manually document everything. Right. And so it takes a lot of the burden off. And what we found, in addition to it saving an hour a day for our providers by giving them this tool, it's also making the information that's getting into the chart so much more accurate and then actionable, to provide better care. So just some of the things that we're doing, and I would say AI as a thread throughout.
Yeah, that was actually going to be my next question, is because AI seems to be the, topic of, the moment. is how TGH was utilizing that. And that's just one way that you mentioned. Is there any other ways? Like, I know, I'm sure on the patient side, there's customer care, like you mentioned.
Yeah, it's funny because when you think about it, I think about it of like such a spectrum, right? So one example would be we have, if you think about a medical device, I think historically you think about some piece of hardware, right? An implantable or something that someone's going to use to derive information or a diagnosis or treatment. Now we have AI as a medical device itself. So the AI algorithm being able to drive a clinical decision. So right now we're working with a company cutely called AI, AEYE,
Yeah.
that uses an AI to diagnose diabetic retinopathy. Which, if you know, if you're diabetic or pre-diabetic, there's a really significant risk of blindness. So you're going to the doctor. Your doctor may tell you, may do an exam, and then say you need to follow up with an ophthalmologist. That may happen, it may not happen, but really the lag in time creates a lot of risk that people won't go back. This, you get the exam, it gets read all in real time, and you know right away, do you need to see an ophthalmologist or not? And we make the referral and the appointment all right in that one visit, which really, really improves the patient care. So you've got kind of that on one end of the spectrum. And then all the way on the other, we have something that seems as simple as, the HR team having to field tons of endless questions about specific benefits and policies and regulations. And now we can have our own kind of TGH chatbot for team members that can, in real time leverage AI to answer benefits questions and free up our team members to be able to do much more impactful work. So, it really crosses the gamut. It's pretty incredible.
Oh, that's amazing. With AI and all this technology obviously brings, the topic of cybersecurity threats. With the threats increasing, how does TGH ensure patient data privacy and security?
Well, this is something that is incredibly important to us. I'm not sure if people understand the volume of data that we sit on as a health system, and it makes us a significant target for cybersecurity threats, and they come from very sophisticated groups across across the world, frankly, and so we have to make sure that we're always educating our team members on these threats, where they come from, and identifying them. So we do a lot with education, which I think is very important for our team members, making sure that they're aware, they know what to look out for. And then another important thing is we don't do this alone. We have a lot of partners that we leverage. And so in terms of providing services or software to do the work that we do. And so a lot of the threat from a cyber perspective comes from those third parties. So my team, in addition to supporting innovation, we also invest in startups. So we have a venture fund. We invest in startups. One of those startups we invested in is a company called Process Bolt, which actually has a pretty cool AI technology to real-time audit those third-party vendors that we work with to make sure that they're compliant, because we can keep our house in order. But if we don't keep the house in order of our third-party vendors that we rely on to provide other services, then we're going to be in big trouble. So that was a really cool company that we invested in, and they're helping us stay safe in terms of cyber risk.
That's great. I love how you're combining the startup innovation part of you still on the side with the TGH and helping it like internally with the hospital.
That's the core of what we do, is
Really?
really is bringing that outside innovation, looking around the corner, understanding what is the newest, latest, and greatest innovation solutions that are being developed that are solving the problems that we have right now in terms of better quality for our patient, better experience for our team members, more efficient, effective. So it's a pretty cool opportunity to have where I've got one foot sort of in the
Yeah.
organization and one that's always outside the organization and being able to like find those matches. And I'm at my core, I'm a connector. That's kind
Mm-hmm.
of where if people ask you like, where's your passion come from? What drives you? It's really making connections. And that's what I get to do every
Yeah.
day. So it's
That's
pretty
great.
fun.
I did not know that. What role does data analytics play in predicting and preventing illnesses at TGH?
Yeah, so great question. There's so much that we're doing to leverage data. We've got an incredible data and business intelligence team. We work side by side with that team in terms of identifying solutions and partners that we can bring in and innovate. But first it starts with being able to know your own data and leverage that data, make it actionable for you. We've got tons of data that can do exactly what you said. Like keep people healthy, understand what diseases and what's happening, but you have to make that data actionable. So we do that in a number of ways, but really exciting. We've partnered with Palantir. They're a company that is a public company. They were noted first and foremost in the defense space, working with the federal government and bringing down Osama bin Laden, most
Wow.
notably. And so we've been able to take their supercharged predictive analytics platform and layer it on top of our electronic health record. And one of the places where we've had the most success is in early detection of sepsis. So this is where I always sit on panels with a lot of doctors, and as soon as I start talking clinical talk, I get nervous. My palms start sweating. I'm like, oh my God, they're gonna know I'm a lawyer, not a doctor. But sepsis is really when you're in the hospital, you're at risk a lot of time of a secondary infection known as sepsis, where you're frankly, if we catch it early, you're going to be just fine. If we're not able to catch it early, it can be very catastrophic in terms of shutting down your organs and a lot of other side effects. And unfortunately, it happens. It happens too often. And so we've been able to use AI and predictive analytics to understand when a patient is in potentially early risk of sepsis and reduce that risk and have been able to significantly decrease mortality as a result. So it's been
Wow.
pretty cool.
That's amazing. You made me think of another point, kind of jumping around a little bit. You, on the subject of data, are you finding a lot of good talent here locally that you hire, like for tech or data, or do you have to go outside the Tampa Bay area to hire these people?
Yeah, that's a great question. I will say we are not opposed to going out of the area where and when we have to, but we do have really great relationships with USF. The USF Morsani College of Medicine is our partner in all things. Where their teaching hospital. We are significantly aligned around that. But the larger university, all of USF, including the College of Engineering and business, and we recruit a significant amount of talent from there, in addition to the data analytics side of things.
That's great.
So yeah, and we have created internship opportunities where we can get talent early, bring them in, and recruit them. And honestly, I think it was last year at Synapse we had some really good success. Leveraging this conference for talent acquisition and hiring. So yeah, there's great talent to be found here, right? I mean, I think everybody knows that, and it's so much different than what people were talking about probably 15 years ago about the
Definitely.
brain drain and people who are here having to leave. You don't have to leave. In fact, I think we're importing people, right?
Right.
Left and right. It feels that way.
Hmm. Yeah, Tampa is definitely evolving as a healthcare innovation hub and just tech hub in general, which I think is exciting. What makes it an exciting place for med tech startups?
Well, it's really interesting. At my talk earlier today at Synapse, I talked a little bit about our Tampa Medical and Research District that we're building alongside the Tampa Bay EDC, the Economic Development Corporation, and the whole goal of that is to get the word out that this is, in fact, a tech hub, right? This is a place, a health tech hub
Mhm.
specifically. We have a number of buyers of med devices and med tech, TGH included, as well as other leading academic institutions and health systems. And I think that the connectivity here from academic to the venture capital that you need to support your business as you grow, it's really just continuing to thrive. So I think, this is a great place for anyone who wants to find talent, find customers, and build a business.
Yeah, I found that interesting that you said that earlier whenever we were talking, just building that health tech hub here, which I love. And really you have to collaborate with all the, like everyone has to collaborate together, and it's not competition, you're like joining forces.
Oh yeah. I mean, if you go
Mhm.
to, let's say, Houston in the TMC, the Texas Medical Center, you'll have Memorial Hermann or Houston Methodist, two of the leading health systems in that market, and they're collaborating around research innovation. Now they're going to compete all day long for, you as a patient and providing the care to you. But from the standpoint of creating that ecosystem, there's a lot of collaboration. And I think you're going to find that more and more in the Tampa Medical and Research District as we continue to grow because it is its own thing. TGH is really wanting to be the match that lights that spark and, along with the EDC. But ultimately, it's a place for everyone. And I think if we do it and we build it successfully, then it's going to create even more of that health tech academic research hub that we all want to see. And the ultimate beneficiary is the community because the economic benefit of that is significant.
Right. Benefits everybody.
Mhm.
What leadership lessons have you learned while driving innovation at TGH?
So that is a good one. I think, innovation is not for the faint of heart. I think it sounds really fun. It sounds exciting to everyone. You think of, robots or drones, and we have those. We have robots and we have drones. But really, it's about building the right relationships and the right trust among your colleagues across the organization that you know that you're going to bring them something of value. So I always say like innovation isn't about bright shiny objects. Sometimes there are shiny objects involved, but really it's about the hard work of solving problems. And so if you're considered someone who understands what those problems are and understands what your colleagues, either the clinical team or the operators, what they need to do their job better, then you're succeeding. So I think that's really what I've learned as a leader is that it's so important to listen and to be able to listen and then connect those dots and bring that value back.
Mhm. It's probably difficult with a company the size of TGH because you have a lot of employees there and you're trying to implement something new. Like, how do you buy in their like trust on this new technology or using this like AI tool? Like, that must be difficult getting everyone to like get on board and trust that it's gonna help
Yeah.
them.
It's incredibly, I mean, they always say the technology is the easy part, right? The change management
Right.
is the hard part, right? The bringing people along, just like you alluded to, is important. And I think honestly, a lot of it starts from the top. Our CEO, John Corus, is unwavering in his commitment to innovation. And he'll always remind our organization that, and our leaders all the way down to our team members that, if the rate of change outside our organization is outpacing what's happening in our organization, we're done for. So we really don't have a choice. But I think it's important that that message consistently comes, from our leadership that this is what we're going to do and this is how we're going to continue not only to survive but to thrive in this challenging environment that we're in. So that doesn't mean that one project isn't still hard. It's not hard to convince or change minds of people or change behaviors that have been, a certain way for a long time. But I do think that culture, an organizational culture, plays a really big role in your ability to get over those obstacles and get, really pushed through those hurdles to getting on the other side of change implementation.
Yeah, I think culture is a big piece of it. What's been the biggest challenge in bringing innovation to a hospital setting, and how have you overcome that?
I mean, I think one of the biggest changes is hospitals and, healthcare settings in particular are risk averse and conservative for good reason, right? You're talking about patients and you're talking about life and death situations. So, some things where you're like, oh, let's just fly by the seat of our pants and, see how it works. The stakes are very high, if you do that. So I think the biggest challenge is sometimes figuring out when is the risk really a risk, or when are people kind of been, or have people been kind of conditioned to look at everything and find the risk or say no? So that measurement of risk to reward has been challenging. But I think it's something that we're overcoming, and some of it is really about finding we call them friendlies, right? You find the friendlies, you find the people who just love what we're doing, they love innovation, you find opportunities to work together. You have a great story to tell of a success and an outcome, and then it really just becomes kind of viral, and everyone wants to be a part of positive change, right? So then you break down the people who are maybe a little bit more resistant, and are not natural born, innovators and rule breakers.
Yeah. So fast forward 10 years from now, what's one innovation that you hope to see in the hospital setting that we don't have now?
Oh, yeah, that's a great question. I mean, with the how quickly AI is changing things, I'm thinking like 10 years, maybe like the equivalent of 1 year.
True, yeah.
But I will say, I think what I would love to have is to see in the hospital setting much more automation. And what I mean by that is it could be physical automation in terms of robots moving our, linens from place to place, or disinfecting a bed, but it also could be automation in the sense of like a nurse now does 10 clicks or different screens to type different things to change your diet in the hospital. And instead, it's an ambient conversation that automatically goes to the dietary team, and it changes things. So I think reducing that friction in the inpatient side through automation, maybe that's cheating because it's so broad, but I really, at the end of the day, running a hospital is like a giant logistics problem. And so if we can make it a little bit more like an Amazon warehouse, and I click on my phone that I want, these cool sunglasses, and then they're there between 6 and 8 p.m. that night, like, that's the kind of automation I think that can really, really help us reduce the staggering costs of healthcare, improve my stay as a patient, improve my life as a bedside nurse. So that's really what I'm most hopeful for.
So is that what excites you most about the future of technology in the healthcare system? Is there anything else?
I think what really excites me the most is being able to see how this technology in a lot of different ways is allowing care providers to get back to their passion, which is caring for patients. So, I think a lot of the joy technology, like early technology, like the electronic health records, for example, like I mentioned at the outset, typing away to make sure sure, it's better than having all those paper files and not being able to have continuity of care because you have all this data and everything. But I think it took a lot of the joy out of patient care for people who have that calling or passion to want to be a bedside nurse or be a primary care doctor. And what excites me the most is being able to give those people back the joy and the passion of like why they wanted to do what they do professionally instead of making them a slave to technologies that we thought were going to make things
Right.
better, but really made some things better, but created more hurdles and challenges in other ways.
No, I love that outlook. And I love what you're doing for the community and for TGH and the hospital system. I think it's great. I feel like every hospital and healthcare facility needs an innovation person like you. So thank you for all that you've done. And
Oh,
thank you
thank
so
you.
much for being on the podcast. It's
Thanks. It
been
was fun.
great.
Appreciate it. Thanks for having me.